We're now honored to be joined by Florida Governor Rick Scott.
Good morning. It's a real honor to be on the phone with everybody. As you know, Florida has been a leader in Medicaid reform. My first session, I was elected in 2010. We passed. We had managed Medicaid in a few counties. We passed it statewide to make sure that we could provide the care that Medicaid recipients deserve, but at a price the state could afford. We are working with the CMS to get it approved because we have to get a waiver, so we're very optimistic that that's going to happen. This last session, we still had a problem. Our Medicaid costs were growing faster than our general revenues. So we're working on making sure our hospitals get paid fairly, but they don't get paid differently they should get paid based on the procedure, not based on where they're located. So we passed significant hospital reform this last session, which will go into effect a year from July 1st. With regard to, I think all of us, I'm very optimistic that the federal government's going to, our Supreme Court's going to declare Obamacare unconstitutional. As you probably know, I organized a group called Conservatives for Patients' Rights back in 2009 to do the things that I believe would drive the cost of health care down and make it so people could afford their care and reduce the number of people that were uninsured. And we focused on the principles of choice, competition, accountability, and personal responsibility. It's the idea that if there's competition, more competition with providers, that generally in most industries it reduces the price, makes access better, quality better. If we allow individuals to buy the health care that they want to buy rather than let the government tell them what to buy, they'll buy what they need, not buy what they don't need, which will drive down the cost. If they give individuals the same tax breaks as employers, then the individual will not lose their insurance when they change jobs, so you'll deal with the pre-existing condition issue. And then finally, allow people to be rewarded for taking care of themselves, eating right, exercising, not smoking. With regard to Medicaid, the right thing is to give us a block grant. Let each state be a laboratory. I know in my case, if I don't do the right thing with regard to taking care of the Medicaid recipients, I won't get reelected. But let us innovate in each state, and let's deal with our own state issues. We also need to do things that we know are working: high deductible plans, expand risk pools, so those that have chronic problems can buy health insurance. So those are things that we ought to be doing, and hopefully we'll have that opportunity when Obamacare is either declared unconstitutional or is repealed. But thanks a lot for the opportunity to be on the phone today.
Thank you, Governor. We're now going to start our Q&A session, and we're going to try to fit in as many of your questions as possible. Press star 6 to be added to the queue. You're going to be prompted by the operator if your line is chosen. Please indicate your name and affiliation as well as who your question is directed at. So with that, we're going to go ahead and take our first question. Your name and affiliation, please.
Hi. Yeah, Ricardo Alonso Zaldivar with the Associated Press. And my question is for Governor Scott. And Governor, nobody really knows what the Supreme Court is going to do. But if it were to uphold the law, if it were to say that, basically the law stands and it remains the law of the land, where does that leave you? Your state has not wanted to implement the exchanges or do anything else to carry out this law. What are your options then?
Well, we'll comply with the law. If it's declared constitutional and it doesn't get repealed, then we'll comply with the law. As you know, we've not taken any federal money with regard to the exchange. But we'll deal with all the issues we have to deal with when we know that it is going to be the law of the land.
All right, we'll take our next question. Please state your name and affiliation.
Hello, my name is Tia Mitchell. I'm a reporter with the Tampa Bay Times and Miami Herald. And I wanted to know, again, my question is directed at Governor Scott. My question is, Governor Scott, what kind of money does the state stand to lose if the law is struck down, especially with the provisions for expanding Medicaid and increasing the payments to primary care physicians?
Well, I think the right way to think about it is what will it cost the state if it's not declared unconstitutional? If you look at what Obamacare does, it's going to ration care. Every government program in the world promises, overpromises, runs out of money, doesn't properly pay providers, hospitals, physicians, which means it's more difficult to get care. And then because the cost is so high, it raises taxes, which impact businesses, impact jobs. So the real cost is going to be if it's declared constitutional and not repealed.
Karen, is there anything you'd like to add?
Well, I think that as the governor mentioned, it's also important to look at. It's not free money from Washington. In fact, it's deficit spending that ultimately taxpayers, whether they're taking money out of their state pocket or their federal pocket, will be responsible for. So it's not the state losing out on free money. It's taxpayers footing the bill for a massive Medicaid expansion. It's part of Obamacare.
All right, we'll move on to our next question. Please state your name and affiliation.
Hi, Sarah Cliff with the Washington Post. This is also a question for Governor Scott and a follow-up on Ricardo's. Do you expect, if the law is upheld and you do move forward in implementation, as you mentioned, you all would be able to build a state-based exchange, or at this point we're kind of far down the line that you all would have HHS coming in and taking over the task for Florida?
We'll decide at the time.
Okay. The sense is you have enough.
We'll decide at the time. We'll have enough time.
All right, we'll take our next question.
Yes, John Reichard with Congressional Quarterly. I had a question for Governor Scott. You've gotten several questions about what would happen in Florida if the law were affirmed. My question is slightly different. What would happen if the law is maintained except for the mandate being eliminated? Would Florida still do an exchange?
If there was no obligation to do an exchange, Florida won't be doing an exchange. If my personal belief is that if an exchange was going to be helpful, then the private sector would already be doing it.
So do you interpret the law then, if the individual mandate is struck down, to say that there would be no requirement for an exchange?
John, I'll look at that at the time.
All right, thank you.
All right, our next question, please. Name and affiliation.
Yes, hi. It's Gary Fineout from the Associated Press. Governor, I'm a bit confused about your comments regarding the healthcare exchange. Since you signed legislation and approved a budget that included more than $30 million for a new platform that would be used to have an eligibility system and the creation of an exchange, so you're now saying that you might allow the feds to come in. So if you could just explain to me, since you've already signed that legislation and have already approved that budgetary item, are you now saying that you would not use that platform as the exchange as the legislation was intended?
Well, Gary, as you know, the purpose of that of anything I've done so far is not to create a state exchange. So that's not been the purpose of anything I've done so far, is to create a state exchange. So at the time that we have to make a decision, if we have to on an exchange, then I'll make a decision whether we'll do it at the state level or at the federal, or allow the federal government to do it.
All right, we have time for just a few more questions. We'll take the next one. Thank you.
Governor Scott, this is Barbara Smith with the Sarasota Herald Tribune. If the Medicaid expansion provision in the Affordable Care Act is overturned by the Supreme Court, how would you like to see Florida go about covering more of its uninsured?
Hi, Ted. I'm good.
And how does your idea about personal accountability play into that?
What I would want to do is take the principles that I believed in when I worked at Conservatives for Patients' Rights, put that together, and make sure that there was as much competition with the providers as possible, create an incentive for providers to come compete in our state, because I believe that works. That would help drive down the cost of health care, improve the quality and service and access. I would try to make sure that as much as possible, consumers that are purchasing health care know what it's costing. I believe in allowing insurance companies to sell across state lines. I would try to work to make sure the federal government gave individuals the same tax breaks to buy health insurance as they give to employers, and then make sure it's easy for insurance companies to reward individuals for doing the right thing with their health care, eating right, exercising, not smoking. make sure that there's no state law that has an adverse impact on expanding high deductible plans. Make sure that there's a state high risk pool for those that have chronic issues that can't buy health insurance. And then I still believe that the federal government ought to give us a block grant of the dollars that we send up there for Medicaid as part of our income taxes, and give it back to us in a block grant and let us figure out the right way of taking those that can't afford health care, because I think we can do a better job than have the federal government dictate how we do it.
All right, our next question, please.
Yes, this is Gene Meyer from Kansas Reporter. Question for the governor. Matter of waivers. We're looking for one in Kansas, too. Why is everybody so confident that we're going to get permission to do something that the federal government is opposing?
Well, I personally believe ours will get approved because we've had a good experience so far. We did ours in a few counties. Now we're expanding it statewide, and our experience has been positive in the state. So I believe that we'll get that expansion. Now, the issue of whether we're going to get a block grant or not is going to be dependent on this next election. I don't think President Obama is going to be supportive of a block grant, but I think Mitt Romney will be, and I think the House and the Senate will be supportive depending on what the president's belief is. So if we do that, then I think we have a significant opportunity to really have 50 laboratories to do the right, and see which is the best approach.
All right, we'll take our next question. Name and affiliation.
Hi, this is Marnie Jameson with the Orlando Sentinel. I have one question for Governor Scott. If the Supreme Court overturns the health care reform law, would you have Florida instate any part of it, for instance, the medical loss ratio aspect, where insurance companies have to spend at least 80 to 85% on patient care? Or what would happen to Florida's 4 million uninsured, the 20-somethings that right now would stay on their parents' policies? If the law is thrown out, what would you think about those two aspects of the Affordable Care Act?
Well, on those two aspects, on covering individuals, I just would make sure we understood the cost of that to all employers and all individuals, and make sure I understood what the cost was before I'd make a decision. On the medical loss ratio, I would not support that.
Thank you.